Chances are, as a clinician, you never do this. What if the nurse before you did? Without knowing it, you just gave your patient hepatitis. The same thing can happen when multi-dose vials are misused, insulin pens are shared, or single-dose vials get combined to avoid drug waste. If other nurses use that same bag, they too will give their patients hepatitis. Even if you never do these things, some clinicians do. In a recent survey of 5,500 clinicians, 15% said they accessed a multi-dose vial with a reused syringe. Nearly 1% of clinicians in that same survey admitted to using the same syringe on multiple patients. Unsafe injection practices by others put your patients at risk, even if you follow safe injection practices all the time. These practices can spread hepatitis, HIV, or bacterial infections from patient to patient. Don't think this can happen in your facility? Over 150,000 patients in the US have already received notifications to get tested for hepatitis and HIV as a result of these practices. That number gets larger each day. One patient decided to make a difference. Meet Evelyn McKnight. Evelyn's a wife, a mom, and an audiologist. She's also a breast cancer survivor. When she got treated, the oncology center didn't follow safe injection practices. They reused syringes and contaminated a large volume saline bag, which they used as a common reservoir for IV flushes. Evelyn contracted hepatitis at the same time she was fighting for her life. At the time Evelyn got hepatitis, she was part of the largest documented hepatitis outbreak. 99 patients treated at her clinic contracted hepatitis C. 6 of her fellow patients survived cancer but died from hepatitis. Evelyn was lucky. She survived cancer and hepatitis. She decided to do something about it. With her husband Tom, she used her lawsuit settlement to found Honor Reform. Honor Reform is a non-profit patient advocacy organization. We work with affected patients, industry, professional organizations, and policymakers to safeguard the injection process for caregivers and patients. Learn more to help your patients stay safe and keep hepatitis and other diseases from going viral because of unsafe practices. Download free educational posters for your facility and get other information at www.honorreform.org/HCP. If you're a patient, it can be difficult to know if clinicians are using safe practices with you. Don't be afraid, it's okay to ask. Find out how at www.honorreform.org/patient.